Hi, my name is Tracy, and I'm the Human Resources Director at Fairfield Memorial Hospital. It's good to be with you, and I want to talk with you briefly about interview and the interviewing process. The first thing I would encourage you to do is be prepared. You have submitted an application to a company or an organization, and they have contacted you to make an appointment to visit with you about the opportunity. Be excited about that and be prepared. Be prompt upon your arrival. Be early. 10 minutes is good. Dress for success. Dress for success doesn't mean that you need to go out and purchase something new, but find something that you feel confident in when you are wearing that. That will come through in your interview process. Think about the role that you are applying for. Maybe that is a business casual role. Maybe that is more of a business role. But think about the job that you're applying for and think about what you would wear in that job and wear that. I would encourage you to be attentive. When you are in your interview, be attentive to the people that you are interviewing with. You are very likely going to be talking to the Human Resources Director, maybe the Personnel Manager. You might have a department manager in there with you. You may have more than one department manager in there with you. Be attentive to each one. Make eye contact with each person. Address as you're speaking or as they're speaking each person. When you are getting asked questions, your answers should be truthful. If you do not have an answer to a particular question, be honest about that. And just let them know that you do not have an answer at this time, but continue through the process. And very likely, as you continue to work through that interview, that answer may come to you. So circle back around to that and go ahead and offer them the answer to that question. There's absolutely nothing wrong with that. You are going to be asked several questions probably. And in thinking about your interview, think about how you would want that to go. But it's also a good idea that the job that you're applying for, Google the questions that you might be asked. Think about the things that they would ask you and how you want to answer those and have your answers prepared. A few may be, what are your competencies? What are the skills that you bring to this job? What equipment have you ran? What programs are you familiar with? What about your motivation? What about the job that you're applying for is appealing to you? Why do you want to join that company, that organization? Why do you want to be a part of that? And what about that job is really drives you? What about your background? That might be something they ask. And asking you about that, they're wanting to get to know you better. What are your experiences? Maybe what your general experiences are, but what are your experiences within the job that you're applying for? So those things might also be included on your resume. The resume is very important to bring that with you. You have put a lot of time and effort into creating your resume, and it is important that you bring that. If you know that you're going to be interviewing with multiple people that day, 2 or 3, bring multiple copies with you so that you can share that with them, as they are going to want to see that and the effort that you put into that. When you are in your interview, feel free to take notes. Bring a piece of paper, have a pen, and take notes. By taking notes, it looks like you are engaged in the interview process. It's also going to be that you are very likely going to get a lot of information passed on to you. And when you leave, you're going to want to reflect back on your interview, but also refer to your notes, because it's going to be hard to remember absolutely everything. So to jot down the key things is very natural and very good idea to do that. Your telephone. Leave your telephone on silent mode. The person that is interviewing you wants your undivided attention, and you can leave your you can leave your phone in your purse, you can leave your phone in your pocket, that it's important to have the phone on silent mode. The last thing I would mention is social media. Be very mindful that whatever you share on social media very likely is going to be viewed by a potential employer in your future. And I will leave that with that. I wish you the very best as you finish up your classes in the semester, and I wish you good luck as you go out into the workforce and start filling out the job applications and the interview process. Have a good day.
Hi, my name is Ashley Johnson. I am a registered nurse and educator for the Health Career Program for Fairfield Memorial Hospital. This program is offered to qualifying local high school seniors who may be interested in the medical field. The Health Career Program takes place over the course of the school year, and at the close of the program, students will be able to take state testing to become a CNA, which is a huge jump start for anyone looking into this career path. First semester, we learn medical terminology and look into careers in healthcare. We're able to job shadow different departments in the hospital and learn from all of the knowledgeable staff firsthand. A few places we get to see are surgery, emergency room, pharmacy, radiology, and several other different places. Second semester, we begin the Certified Nursing Assistant portion of the program. During this portion of training, they learn to take care of patients safely in the classroom, and then we take that to the clinical setting in the hospital and get to perform that on actual patients. We're really fortunate to be here on Fairfield Memorial's campus. It gives the students a lot of chances to see and do some really amazing things. Obviously, due to COVID, we've had to change things up a little bit, which is pretty common in healthcare, but everything's working out, so it's going well. Fairfield Memorial offers amazing opportunities for growth, not only for students, but for staff as well. I should know, I've been here for over 20 years. I started as a CNA on the medical surgical unit myself while I was going through nursing school, and then worked as a registered nurse on medical surgical unit. I then went to the emergency room where I spent the majority of my career, and then worked my way into a position as an educator. I don't think people realize how diverse you have to be to work in a rural facility like FMH. So we do a little bit of everything on a smaller scale. I have worked as a PRN nurse filling in at larger facilities, but nothing compares to the compassion and care and close family feeling you get from Fairfield Memorial Hospital.
Good morning. My name is Hazel Vest, and I am the surgery nurse manager here at Fairfield Memorial Hospital. I'm coming to you today in order to let you know about some of the things that go on in the surgery department, hoping that you're interested in a medical or nursing career that could take you our way someday. Our surgery department takes care of patients before surgery, in the operating room during surgery, and after surgery. We have both registered nurses. We have one LPN who's a scrub tech, and we do have other people who are scrub techs, even though they're not nurses. We do anticipate a lot of growth within our department here in the very near future with the addition of an orthopedic surgeon and orthopedic surgery. With growth brings the need for additional qualified staff. In order to work in surgery and to do any of the things that I've mentioned about taking care of patients before, during, or after surgery, you would need to go to either nursing school or to scrub tech school to learn how to scrub so that you could assist the physician during the actual surgeries. Once you do that, we do have a training program within the department that's specific to the things that you'll be doing in the position that you are hired to fill. That training program can be as long as 4 months, so that we actually don't just orient you to the department. We're training you so that you can give safe care in the area in which you have chosen to or been qualified to work. We do hope that we can have people that are interested in our hospital and in my surgery department from here in the community. When that happens, you are taking care of people that are important to everyone. You're taking care of patients, and you're taking care of their families. And many of them are from our community, and therefore you are helping the people who you actually do live around. And sometimes those can be family members, good friends, or just very good people that need our care. We do hope that you consider us for employment in the nursing profession or as a scrub tech within our department. We do want and need people who are dedicated to taking care of those in a very safe and professional manner. And again, we give the training and education within our department to help you meet those goals so that you can take care of patients. We hope that we interest you. We hope that our profession interests you. We hope that you go to the schools nearby that can get you into these programs, into our area of expertise. Thank you.
Hi, my name is Stephanie Martin. I'm the Med-Surg ICU manager here at Fairfield Memorial Hospital. Within our unit, we have registered nurses and certified nursing assistants. We require at least an associate degree in nursing or certification of the CNA program to work here. We offer great competitive wages as well as a scholarship program for selected candidates. On our Med-Surg ICU units, we care for a wide variety of general surgery patients, medical patients, as well as outpatient services to our community so that they don't have to travel long distances. We're one of the only places in the area to do this type of thing. As our expansion project completes in just a few months, our orthopedic surgery unit will be up and running. And then we will be taking care of those types of patients such as knee replacements, hip replacements, different types of fractures. I began my career in a large hospital, but what I love so much about this hospital is the feeling of family, not only with coworkers, but with the patients. Being a small community, not only are we able to provide excellent patient care, but we're able to develop great relationships with them. Our mission is to positively influence the health of those we serve, and every single person within our hospital is here for that very same reason, our patients. Everyone within any department at any given time never hesitates to help one another in a time of need, from maintenance all the way up to the CEO. That is something you just don't find everywhere. That's the type of culture that you want to have in a place that you work, and we would love to have you. We're always looking for enthusiastic nurses and CNAs on our unit who want to be part of our team and truly enjoy helping others and want to make a difference in our community. We have a phenomenal team of doctors, nurses, and nurse practitioners who would love to help you grow and give you the best possible learning experience beyond schooling.
Hi, my name is Mariah Miner, and I am the director of the third floor at Fairfield Memorial Hospital. We are a skilled care unit. We mostly employ registered nurses to take care of our nursing needs for our residents. And we also employ CNAs, certified nurse assistants, to provide basic ADL care for our residents. The majority of our nurses currently have an associate's degree, which is typically the 2-year degree for your nursing program. We see many types of patients on skilled care. We have patients who are here long-term to live, and this is their home. And then we have several patients who come here post-hospitalization for care that they may need as far as surgical or after a pneumonia. We do a lot of physical therapy and a lot of IV medications for those type of patients. Working on skilled care has been one of the greatest career paths that I've chosen. It gives me the opportunity to spend a lot of one-on-one time with the patients that we care for. They become more like family than just a patient that you care for a short amount of time. Seeing somebody come in post-hip who's unable to walk, and then we graduate them to where they're walking them and they are home taking care of themselves, that's one of the greatest rewards that we have. It is definitely a good field to be in. We provide 24-hour care for all of our residents. Working on skilled care gives you the opportunity to really work on your assessment skills, on your basic nursing foundations that will help you build your confidence in your career as a nurse. It will give you a good, solid foundation. Getting the experience of learning a good assessment and being able to walk by a resident and know that there's something different about them today, and then understand how to assess them and then know how to treat them is a big part of being a nurse. That's what definitely sets us apart from other facilities. Being a part of Fairfield Memorial Hospital and being a manager of a unit here has been one of the best decisions I have made as far as career-wise. It is very rewarding to work with a talented bunch of nurses that we have employed for us. Being able to care for people in our community is very important to me, and I hope if anybody is looking for a position of any sort that you look at Fairfield Memorial Hospital first. Thank you.
Hello, my name is Rachel Millman. I'm the Emergency Department Nurse Manager at Fairfield Memorial Hospital. There are many opportunities working at Fairfield Memorial. It's close to home, there's a family-like atmosphere, and also there's opportunities for growth. Working as an emergency room nurse is very rewarding, from performing CPR to save people's lives to providing medications that can reverse the effects of a stroke. There are scholarship opportunities at Fairfield Memorial Hospital that can help you reach your nursing degree. We also provide employment for after you reach that goal of a degree. If you'd like to further your education after an associate's degree, that is also available. Please think of Fairfield Memorial Hospital when you are going to college and trying to find work in the future. Thank you.
Hi, my name's Christy Whitehead, and I am the Home Health Director at Fairfield Memorial Hospital. If there's ever an interest in home health, what we do is we see patients in their home. It takes a doctor's order to start up home health. A lot of them can just be in the clinic and the physician thinks they need some therapy at home. So they will order home health for physical therapy or occupational therapy or speech therapy. The patient may come home from the hospital and have wound care that is needed and they don't have a caregiver or they can't reach the wound themselves, and then the doctor will order nursing to go in and perform the wound care. We also can do IV antibiotics in the home. If the patient is in the hospital and is only receiving IV antibiotics once a day, there's no reason to stay in the hospital, so the doctor will send them home and order home health. We use an infusion company that will bring the medication to the home and all the supplies. We will teach a family member on how to administer the medication. If the patient has nobody, then the nurses will provide that care. We will also do the PICC line dressing changes or central line dressing changes. We are not emergency equipped, so we don't carry medications and we don't supply oxygen to patients. If a patient needs that type of assistance through the night, sometimes we can call the on-call doctor and get an order, but they can't pick up their medications until the next day. We typically keep our patients for about 60 days, sometimes not as long, sometimes longer. The majority of our patients are elderly and Medicare, but we can take patients from newborn to 110. The only thing with home health is if you want to do home health nursing, you need at least a year of med-surg experience. The nurses are out in the field on their own. You have to be able to spot and pick up when the patient might be having complications. Home health is a very rewarding job. You see the patient from the beginning to the end at discharge. So if you're interested in working home health, get some experience, med-surg, ER, and come and join us. Thank you.
Hi, I'm Whitney Buckles. I'm the registered dietitian at Fairfield Memorial Hospital. I've been with the organization for about 10 years and I really enjoy my job here. Being an acute care facility, I am the only full-time dietitian, which means that I cover all the nutrition services that are required. There is 4 main areas that I work with. The first is inpatients. I do assessments on patients on our med-surg, ICU, and skilled care unit. This involves looking at their medical history, their height and weight, their GI problems, any food allergies, and making recommendations based on what I find. Certain things that I do would be changing diet orders, recommending supplements, managing tube feedings, as well as educating the patient and family prior to discharge. The second area I work with is outpatients. This is what people typically envision when they think of a dietitian. That is one-on-one education for a lot of diagnoses, but most commonly obesity and diabetes. The third area of my job is food service based. So I work closely with our dietary manager and our dietary staff to create and implement the menus for our patients to make sure that we meet all of the required guidelines, as well as following all the different diet orders that are required. The last part of my job is focused on community outreach. So that's things like health fairs, speaking for community groups, planning the community garden, and writing articles for local publications. Things I like about my job are that it includes a lot of variety, so no two days look exactly the same, and I also get to work closely with other departments like speech therapy, diabetes education, of course dietary, as well as nurses on every unit to make sure that the job gets done. And most importantly, I think nutrition matters, and I've seen that it makes a big difference in how our patients feel and how they recover.
Hi, my name is Kendra Schnicker. I'm the cardiopulmonary manager here at Fairfield Memorial Hospital. I'm a respiratory care practitioner, and that is a degree, a 2-year degree that specializes in diseases and conditions of the heart and lung. So I'm involved in the evaluation, treatment, management, and care of patients with deficiencies and abnormalities of the heart and lung. I perform a wide range of testing to assist the physicians in the diagnosis and treatment of these patients. So basically any patient that comes into our facility with any trouble breathing or with their heart, we're probably going to see. We might administer medication to a patient to help them breathe easier. We might suction out their airway to clean that out, to clean the sputum out of their lungs. We might put them on a device to help them breathe easier if they're having great difficulty breathing, or if they're unable to breathe at all on their own, we'll put them on a machine to breathe for them. We perform a wide range of testing. We might walk a patient to determine the need for oxygen at home. We do heart tests to determine if a patient might have coronary artery disease, to check for arrhythmias or the effectiveness of their medication. We also do breathing tests to determine if a patient has a restrictive or an obstructive airway disease. So we get to do a lot of different things because we're a small hospital. It's not just one specific thing day in and day out. So there's a lot of variety in what we get to do. Because we're a small hospital, we work with a great group of physicians. They are really good to listen to our ideas or suggestions, recommendations for patients. They're really easy to talk to and get along with. It's really nice to work so close to home because my 8-hour shift isn't much more than 8 hours. I don't spend an hour driving to work and an hour driving home, so I really like the fact that I get to be close to home. I've worked with a lot of these people for many years, and it's just kind of become family to me. We're very close. We might even do activities outside of work together. We're there whenever people go through hard times. So it's very, very close-knit family here at Fairfield Memorial. What I do is very rewarding. I get to see patients improve. I get to see when they come in how sick they are, how short of breath they might be, see them improve with medications, antibiotics, breathing treatments, different types of therapies that we can do for them to help them feel better and go home.
Right. I'm Jennifer Bowers, the Therapy Services Director at Fairfield Memorial Hospital. In our Therapy Services Department here at FMH, we offer physical, occupational, and speech therapy services to all ages, from infant to geriatric. Providing these services are 14 therapists and therapist assistants with an additional 9 as-needed therapists. We employ physical therapists whose education requires a doctorate degree from a university accredited program, and physical therapist assistants requiring an associate's degree from an accredited program. Using modalities such as ultrasound, electrical stimulation, combined with lots of exercise, these therapists treat a variety of conditions from acute and chronic neurological conditions, orthopedic injuries, fractures, sprains, strains, surgeries of the hip, knee, ankle, and shoulder. They also treat patients with neck and back pain or other pain syndromes. Occupational therapists are also staffed at Fairfield Memorial. OTs, as we call them, are educated as well at an accredited university, receiving either a master's or a doctorate degree depending upon the program that they enter. Occupational therapist assistants, or OTAs, must graduate from an accredited program as well and receive an associate's degree. OTs and OTAs treat neurological patients by helping them regain the ability to care for themselves, often training the patients with adaptive equipment. They can also make custom splints and treat orthopedic injuries of the elbow, wrist, sometimes shoulder and hands, both post-operatively and just post-injury. They use modalities similar to what physical therapy staff use, as well as lots of exercise. Speech therapist, also referred to as a speech language pathologist or an SLP, that are employed here at Fairfield Memorial will have a master's degree from an accredited program. Our SLPs see patients with feeding issues, swallowing difficulties, and speech and language concerns. They can perform a swallow study in conjunction with our radiology department called a modified barium swallow. And they can also perform vital stimulation, which is a form of electrical stimulation to the throat muscles to help with swallowing issues. So physical, occupational, and speech therapy are offered in a variety of settings within our facility. The first being outpatient. That is where the patients come from their home into us, to our department, to receive their services. We see inpatients, which is a patient that has been admitted to the hospital, and then we will go into their room to see them for their therapy services. We also have a skilled care unit here at Fairfield Memorial, and similar to the inpatient in that we go to the patient's room to see them. Those patients are typically in the facility for an extended period of time, specifically to get rehabilitated and then ideally return home. We also provide home health therapy services out of our department. Our therapy services team members travel within our community and the surrounding communities to provide therapy services to patients inside their own homes. So each of the therapy disciplines plays a vital role in fully rehabilitating a patient that may be in a very challenging or vulnerable point in their life. So therapy is a rewarding career choice if you'd like to be a little light at the end of someone's tunnel.
Hi, I'm Robbie Hale. I'm the lab manager at Fairfield Memorial Hospital. I've been in the laboratory field for almost 40 years, and I'm here to change your mind and hopefully get you to be interested in laboratory medicine. There are a lot of different departments in the laboratory, so it can hold a lot of different interests. The first department I'm going to talk to you about is microbiology. Microbiology is basically the study of microorganisms or bacteria. We like to call them bugs. What we do in microbiology is we take the cultures and we plate them on auger plates so that they can grow faster, and we put after we grow them, we put them in little microwell plates, and this allows us to ID the organism so we can tell the doctor if it's a E. coli or a Pseudomonas or a staph or a strep. And then we go even further. We take that organism and we detect what antibiotics can be used for that organism. So like if we have a strep, we can tell the doctor that it's, they can use Zithromax or one of the other antibiotics to get rid of that organism. So anyway, if bugs isn't your bag, then we have other departments that you can learn. Transfusion medicine. Transfusion medicine has to do with blood. We get our blood from the American Red Cross. We take the blood and we prepare it for the patient. We are the people that make sure that you get the right type of blood and the right blood for each different person. We also do, besides blood, we do fresh frozen plasma, and we also give platelets. Fresh frozen plasma and platelets are like for chemo patients. We also, would give blood in cases of trauma, or, we also have blood ready for surgery in case you're needed. So if that still doesn't convince you, we have other departments that we can take you to. Clinical chemistry. In clinical chemistry, we do over 150 different tests, and on all different kinds of specimens. We do it on urine, we do it on serum, we do it on plasma. We can tell the doctor if you're having a heart attack, if you've got diabetes, if if your pancreas is not working right, if your kidneys aren't working right. We have a test for almost every major organ of the body. And if other than that, we can also tell you if you are pregnant or how far along you are in your pregnancy. We can tell you by a simple blood test if you have been doing drugs. We can do drugs of abuse. We also can test for blood clots, so like if you're having pulmonary embolisms or deep vein thrombosis. The clinical chemistry department is one of the main departments in the hospital. and it is what the doctors use to diagnose patients. If it wasn't for the lab tests, then they would have a really hard time, figuring out what's wrong with you. So lab is very important in diagnosing and treating patients. That still doesn't convince you. We have others. We have hematology. Hematology is basically the study of cells. We can tell whether you have an anemia or a polycythemia. What that means is either you have not enough blood or you have too much blood. So other than that, we can tell different kinds of cancers from your blood. We can do lymphomas, anemias, leukemias, thalassemias. All this can be tested and discovered from a blood test. You'll be trained to specifically look at slides and tell whether these cells are normal or abnormal. We look at the white cells, which are all indicators of infection, either viral or bacterial. We look at things like eosinophils, which has to do with allergic type reactions. We look at monocytes. Everybody knows what mono is. And we also look at things like basophils, which are specific in lead poisoning. And if that still doesn't thrill you, we have another department which is kind of new in the lab world. It's called molecular biology. As everybody is aware of, the last pandemic that we've had, COVID-19, it's the lab that diagnoses whether you have COVID-19 or not. We have a test called a respiratory panel, and we can tell about 20 different viruses from one sample. We can tell if you have the flu, if you have the COVID-19, or a myriad of other viruses that are out there, because everybody always knows about COVID and the flu, but there's hundreds of viruses that can cause respiratory illnesses. On this same molecular panel, we can do things that for gastrointestinal type illnesses. So we are at the forefront of diagnosing and treating patients. So if you want to make a change in your life and change the lives of others, you need to be in the laboratory medicine.
Hi everyone, my name's Kristen Bolt. I work here in the business office for Fairfield Memorial Hospital. The business office is comprised of 2 different departments, hospital admitting and then billing. Both very essential roles, but very different as well. So hospital admitting is one that high school diploma is what's required, or GED for the position. It is the more people person job. If you're, like working with the public, this is a great role for you. Oftentimes the person in admitting is one of the first, if not the first person that the patient is coming in contact with. So you get that chance to make that good first impression from the get-go and help set the stage for their experience here at FMH. The position is also one that does quite a bit of data entry. Making sure the patient's address is correct, phone number, emergency contact, because if that's needed, it's very important that we have that information up to date for that patient and their family. By contrast, billing is a much more task-specific role as well. High school diploma, GED is required, associates preferred but not required. We do a lot of training on the job. Insurance is something that can scare people, but it's not scary. It really isn't. I think of being a biller as being a little bit more of a detective. It's not so much what you're doing for the 90% of claims that you send out and you get payment back from whether it's the insurance company or the patient. It's the 10% of the problems of figuring out what went wrong. Was it our end? Do we need to fix something? Was it their end? Do we need to how do we get them to realize they should have paid and why? So, a lot of people think of a hospital and they think of the clinical roles, which are here and extremely important, but there's other administrative, clerical roles as well that are just of a benefit to the hospital and just as rewarding for the employees as well.
Hi, this is Susan Suddarth. I'm the Health Information Director at Fairfield Memorial Hospital. The Health Information Department contributes to superior patient care by ensuring that all patient medical records are assembled as complete and accurate in a timely fashion as possible. How do we do this? Well, first of all, as Health Information Director, I oversee the day-to-day operations of the department and interface with other department managers as appropriate. We have a Health Information Clerk staff that processes the records by assembling, scanning, reviewing, and releasing them as appropriate. We also have a coding team that assigns diagnosis and procedure codes as appropriate so that we can submit the claims to insurance companies and get the best reimbursement possible. Working in this department may not seem exciting, but it really is. Educational requirements for HIM clerks are medical office experience and a little medical terminology. Coders usually go through a 1 to 2 year college program and sit for a credentialing through AHIMA or AAPC. As Health Information Director, I feel good about myself every day. I feel like I'm giving back to the community, and Fairfield Memorial is a great place to work.
My name's Melinda. I'm the Director of Diagnostic Imaging Department here at Fairfield Memorial Hospital. Radiology has a broad spectrum of modalities that we can specialize in here. We have X-ray, mammography, CT, bone density, ultrasound, and nuclear medicine. We also have 2 mobile trucks that come in, mobile MRI and mobile PET CT, that come into our hospital. The schooling all depends on what modality you want to go into. A radiology degree is usually 2 years. If you want to go on into ultrasound, it's usually another year after that. The good thing about FMH is once you have your radiology degree, you can cross-train into CT or possible other different modalities without having to go into any more schooling. Radiology is a very rewarding field to go into. A lot of times we see what's going on inside the patient before anybody else does. I'm so thankful that I started my career here at FMH back in 2000, and I've had such a wonderful time doing ultrasound. We are a small town hospital with big opportunities, and I'm so grateful to work here.
Hi, my name is Michaela, and I'm an outpatient behavioral health therapist here at Fairfield Memorial. There are many different career paths when it comes to behavioral health. There's psychology, psychiatry, social work, or licensed professional counselors. Here at FMH, we employ master's level clinicians, which include social workers and professional counselors. When it comes to behavioral health and what would draw someone to the career, there are many different things that come to mind, but the biggest thing for me is the fact that it's a helping profession. When I think about that, I think about creating a space and allowing someone to come in and discuss whatever they need to discuss. That's going to impact multiple different parts of their life. It's not only going to impact their mental health, but it's also going to impact their physical health. For FMH, we provide that type of environment, and we include not only mental health, but physical health as well. We're serving our community and surrounding communities as well, and we're providing multiple areas for people to come in and seek care. In my position, I think the thing that sticks out the most to me is I'm not only able to serve my community, but I'm able to do it through a lens that I'm so incredibly passionate about.
Hi, my name is Jeff Wise. I'm the Director of Plant Operations here at Fairfield Memorial Hospital. I've been here close to 19 years now. What we do is we try to make sure that the environment is safe for our patients and our workers. We do preventive maintenance on around 500 different pieces of equipment. I'm also over the biomed department to ensure that the medical equipment is all checked and is in proper working order. We also take care of the air conditioning and heating systems. We have boilers, air conditioners that we have to clean, keep running. We do general maintenance also, changing light bulbs. We have a variety of other duties that we do. I'm also the safety officer and security. We are security during the day in case there's any issues. I think it would be a good opportunity for some people to go into the healthcare field. I know it's been very rewarding for me. I came from an industrial background, worked at Airtex Products as a maintenance manager there. We've come a long ways since I've started here. We've had 3 or 4 major building projects, so I'm directly involved in that to make sure that all the codes are met. That kind of segues into other areas. We have to make sure our fire alarms are working correctly. They have to be tested. We have to do fire drills. We have to make sure the fire suppression system works and that it has been tested to ensure the safety in case of a fire. I think it's been very rewarding to me. My job changes daily. You never know what's going to happen that day. We've helped with COVID vaccines, parking people. I think if you're a high school kid and you're looking for a career, healthcare could be for you. Thank you very much.
My name is Keena Warren, and I am the Director of the Environmental Services Department at Fairfield Memorial Hospital. Our team is responsible for the safety and cleanliness of the hospital and medical arts complex, which includes cleaning patient rooms, all areas of the medical facility, including exam rooms and surgery rooms, laboratories, public spaces, offices, and administrative areas. The primary goal of the Environmental Services team is to act as the front line of defense against infection. And we do this by making sure everything is sanitized, from equipment to beds, to linens, to light switches. And all this adds to the patient's safety and health during their time of recovery. Our positions require the proper handling of various types of equipment and an understanding of the proper use of disinfecting chemicals. At Fairfield Memorial, the entire caregiving team fosters a culture of working together to positively influence the health of those we serve. That's our mission statement. And today, more than ever, the Environmental Services team is recognized for their contribution to the well-being, comfort, and safety of our patients. So if you're looking to work in a positive environment with a group that makes a difference, that's us. We take pride in our work and strive to be a friendly face every day in the hallways and in patient rooms. That's the Environmental Services Department at Fairfield Memorial Hospital.